Please, for a change, there is no PowerPoint. Look at me. For a change, there is no PowerPoint. The National Planning Authority has produced a national development plan. And what you should need to know, that a national development plan is just a national planning framework. It is just a framework which has just indicators. But the onus of getting these issues even in the national development plan and explaining what they are and how to be done should be at the sector level. So if we went wrong at the beginning when we are sending guidelines for writing the national development plan, then the national development plan, whatever, could not capture what was not included. Because we sent guidelines to even the districts and local authorities. And then what comes, we put them together in a manner to be systematic. Otherwise, the language in each sector belongs to to those technical staff in those sectors. So I thought this should come out clearly, because everybody is looking in the national development plan, the details. The details may not be there. And what you have, some of you, is just the framework, but we have a cost matrix which shows the vote function, how much money, what activities are required, and for each, how much funds are required for each activity. And these activities were worked out together with each sector. Now, the National Development Plan recognizes that actually nutrition is a cross-cutting issue. And that's where the danger is. Being a cross-cutting issue, because we have been using a budgetary approach where each one, budgetary allocation, most of the departments and ministries have a tendency just to look at the core activities in their respective departments and ministries. And the interlinkages with other sectors are missed. And nutrition, this way, is one of the weaknesses. And since this morning there have been a lot of lamenting. I hope tomorrow we shall have come up with a solution, because all this is known to you. And you have learned it, some of us who didn't have school fees for what you learned. But you have educated us. Now we know. But the cross-cutting issue and the coordination matter are still a challenge. In fact, I have liked his presentation, one of the slides. Should we really have, instead, should we have a specialized agency in order to handle this in the office of the president or in the office of the prime minister? Because the National Council, the Food and Nutrition Council, it is there. Well, there is a need to align it with NDP now, but it could still function. But there is no convener. Though it belongs to Ministry of what? Agriculture. I remember when I was Minister of Agriculture, I tried to bring Chidu Makubia when he was Minister of Education, to bring I think it was the friend of Mwezi, when they were in the Ministry of Health, to talk about the national, the Food and Nutrition Council. And we had started moving. That's how we drove the food and nutrition policy. Since then, it disappeared. It should not be on personal account. It should be really an institution, so that whoever gets there can drive it. But then when it needs, you don't need to be a heavyweight to drive a trailer. Even a small person, as long as you know the principles, you can brave it. So it doesn't mean it is somebody's type who will be there something to run. So that's the challenge you have. And it should be solved through this. Because I believe what will come from these presentations will be evidence-based. We can use it. And we are positioning National Planning Authority to become convener for cross-cutting issues as kick-starting. So don't envy, don't think we are becoming rivals. No, we are not implementers. But what the NDP will be measured by what has been implemented in each sector. And if some of these cross-cutting issues are not coming up, so I'm positioning myself, and we are asking for some leverage, which we shall get in order to convene, but for kick-starting. So, 3 minutes are finished. We see MAIF and the Ministry of Health as the ministries in food security and nutrition issues, and mandated by the Constitution to set minimum standards. Because you see there's legal issues which you cannot ignore. According to our Constitution, it is the Ministry of Health, Ministry of Agriculture, Animal Industry and Fisheries, and the Ministry of Health, which are mandated to set minimum standards, ensure quality and develop relevant policies. The specific mandate of the Ministry of Health is to improve the quality of health services and ensure equity in assessing essential health services with the overall goal of reducing morbidity and mortality. This nutrition is also embodied there. And that's why even the challenges, Chair Moderator, is that even in the Ministry of Health, nutrition is also lost despite of the existence of Professor Madra. It is also lost because of morbidity, and I've been educated to understand that it covers diseases, all other diseases. So, when we are talking about, that's why I find the malaria is prominent, HIV, and others. But nutrition is not a disease. They don't see it as such. Even when they analyze it, I don't think a doctor has ever told somebody that this is because of malnutrition. When you go to diagnose so that you are treated. Except recently, where a member of parliament slapped. It's alleged to have slapped him. Someone who had a child who was malnourished. Then I read in the papers later that you see, it was malnourishment, and the child had come up. That's the only incident I am aware, publicly declared, but maybe the real doctor couldn't pronounce the treated other diseases. So, nutrition is essentially in a national development plan. Nutrition is essentially covered under the thematic areas of health and agriculture development in the national development plan. NDP acknowledges nutrition as a critical for the health and well-being of children and the families. Nutrition in the NDP is objective number 3 of the health and nutrition thematic areas. And the following strategic areas have been identified. 1, support maternal and child initiatives to promote child survival, growth and development. The proposed interventions are many under that. Another one is strengthen mechanisms for control and prevention of micronutrients deficiencies. It has also interventions. But now also, during that period when I enjoyed the Ministry of Agriculture, that's when we opened the Biotechnology Center. His Excellency had to fly all the way from Guru to come when I had convinced the cabinet that biotechnology is necessary for this country. He commissioned the biotechnology center in Kawan. And what was lacking on that day, they told me that they didn't have a gun. Not this, I mean, not your, you know, for gun you understand these things. But they had something which they used to transfer certain traits to, especially for the banana, so that we can have drought resistance banana, disease resistance bananas, the weevils and the wilts and what have you. And I hope that gun, they must have already achieved it. But now, the law is, because the science and technology is allocated under Ministry of Finance, the therefore Ministry of Finance is the one to drive the law in the cabinet. I have been a minister, but when you're a Minister of Finance, and I was there too, you can't think of biotechnology when you have not balanced your revenue. Finally, sir, in conclusion, to operationalize nutrition in NDP is more than just focusing on the sector, but on how it can be integrated in Ministry of Local Government, Ministry of Labour, Gender and Social Development, Ministry of Education and Sports, Ministry of Health, Ministry of Local Government and the district local authorities, NGOs, community-based organizations, and the private sector plans and strategies. We need to cover all this. Professor Jessica Funda, when she was presenting, she was saying there are many projects, and I saw here the projects. But now what I have realized, another weakness, I have not put it in my presentation, but I'm going to include it, is that we are talking about outputs for each of those projects. But I think there are no evaluation of the outcomes. Anyway, I don't like to take you past from this. But the issue is, if really all those projects have been working, we should have a difference. Secondly, if a project is to last 3 years, any responsible person should see how to integrate it in the mainstream. The weakness which is happening is that when the ministry, and there are newspapers, when one ministry doesn't work, they create an agency. And the ministries are losing the responsibility. So in this case, if really the science and technology is not moving, I mean the National Council, we may think of creating an agency to drive the Food and Nutrition Council, so that we overcome, we implement what we have put down. But when you see that this agency, then it will encroach on the Ministry of Health, it will encroach on the responsibility of the Ministry of what? Of Agriculture. Most finally now, we need an integrated approach, linking all underlying causes of health as it has been put there. So, 2 issues: coordination, cross-cutting. If you can come up with the answer at the end of the day, the National Planning Authority, under my chairmanship, is ready to drive in the next 3 years. Thank you, sir.